Well, back in Australia, leading public health experts have accused the food and beverage lobby of being a key obstacle to improving health. Four of Australia's most senior health experts, including the chairman of the government's Preventative Health Task Force, Professor Rob Moody, have told Lateline that the industry lobby group, the Australian Food and Grocery Council, has too much government influence and is delaying effective action against diet-related diseases. This exclusive report from Margot O'Neill.
Sydney University Professor Bruce Neal's special interest in our diets is salt. How most of it comes from processed foods like bread, how it contributes to high blood pressure causing heart attacks and strokes, and how most people eat up to 10 times as much as they need without knowing.
You know, delicious sandwich here. What's in it? I have no idea. It's sort of impossible to actually, go round and select, low-salt foods unless you are some very well-informed, sort of weirdo, to be honest.
Reducing salt in processed foods can bring as many or more health benefits to society as tobacco controls, which is why Professor Neal works closely with food companies to measure salt in their products.
When I came to this area, it was apparent to me that you'd sort of got public health over one side, industry over the other side, sort of throwing insults at each other but not really achieving a lot.
Now he's taking aim at the main processed food lobby, the Australian Food and Grocery Council, for blocking vital public health reforms needed to slow the epidemic of diet-related disease.
We have foods that are causing an enormous burden of premature death and disability because of excess salt, excess saturated fat, huge numbers of calories and small portion sizes. And what we're not seeing is the Food and Grocery Council taking the leadership to try and make this better. Instead, what we're seeing is the Food and Grocery Council sort of employing delaying tactics, watering down the key strategies here.
Other leading public health experts agree.
The influence that industry has over government policy is probably the single biggest barrier to getting effective policies in place for obesity prevention.
My public health colleagues are basically saying to me with one voice that they are very concerned that the influence the Food and Grocery Council and its members have on government.
Certainly the food industry has far too strong a voice. And it's using some of the same tactics as the tobacco companies have used over the years.
There's no doubting the political muscle of the Australian Food and Grocery Council, which represents a $102 billion food, drink and grocery manufacturing industry with multinational members such as Coke, Kellogg's and Nestle. But Chief Executive Kate Carnell rejects the tobacco lobby analogy.
Because it's obviously silly. Tobaccos kill you, cigarettes kill you. One cigarette is one too many. One chocolate is not one chocolate too many. The simple message that somehow confectionery causes obesity is simply silly, whereas tobacco does cause cancer.
But health advocates say the council mimics the delaying tactics of the tobacco lobby, such as countering consensus research about the importance of banning junk food ads for kids.
There is no evidence at all to link food advertising to obesity. Zero. Nowhere in the world.
There's cast iron evidence that this promotion influences children's preferences, influences their consumption and what they nag their parents for.
Most public health experts agree on what should be done to stop the epidemic, and that includes a tough new era of government intervention, such as reducing the amount of salt, fat and sugar in processed foods, warning labels on packaging, and banning all TV, sporting and online junk food ads to kids. The food industry says it's introduced voluntary codes to address these issues, like initiating a food and health dialogue to reformulate levels of salt, sugar and fat.
There's no delay. We went to the government to form the food and health dialogue and started the process of reformulation. We have an industry code that has banned advertising of high fat, high sugar, high salt products to children. We're going down the path of a single front of pack labelling system. Doesn't sound like holding back to me.
But there's a chorus of criticism that these are half measures at best. For instance, the voluntary ban on junk food ads doesn't cover when most kids are watching TV and hasn't diminished how much they're exposed to.
At the moment, obesity is fundamentally a commercial success. And watch the cricket, for example, you can have just KFC, Macca's, Solo, VB, then a car. And this is what you have constantly for 3 hours, and that's what our kids are getting.
Professor Neil says the pace of reducing salt has been so glacial, it will take Australia 10 years to catch up with the UK and the US.
We are seeing in Australia thousands of premature strokes and heart attacks occurring each year as a consequence of excess salt consumption. If you also factored in the death and disability that's being caused by excess saturated fat and the like, it would be really quite enormous.
They're a lobby group. They're lobbying for what they, for pushing this agenda as quickly as possible. That's their job. Similarly with us, we're absolutely on board with delivering lower salt, lower sugar, lower fat products. Obviously it's companies that have to do the work, have to do the reformulation, have to spend the money, have to do the marketing and so on. So obviously that's going to take a little bit longer than just putting out a press release, which is all some of the public health lobby have to do.
Goodness gracious, that's interesting for the AFGC to be calling us a lobby group. The AFGC and other commercial lobby groups are the heavily funded ones which have direct access to politicians in Canberra.
It is fair to say that government has listened to us. They listened to us very closely and clearly on tobacco and have done absolutely fabulous work there over the last few years. What we want to see is a similar level of commitment, a similar level of action with regard to obesity and to healthy food in general.
Margot O'Neill, Lateline.